So my clients who are with ICHRA actually happen to be in the healthcare space. And so there's kind of some unique challenges there in terms of not only just operationally and cost involved with that, but also staying competitive. And so for one of my clients in particular this year, so they have a lot of turnover in that industry specifically. And so what that has meant for them year over year is that there are continued increases because of high cost claimants that are just kind of astronomically increasing year over year. And so for one of my clients in particular this year, they were facing, another 20% increase, self-funded client. And they came to us and said, we can't absorb, this was going to be probably another $3 million on top of what they were already spending. And they said, we need alternative solutions. We need to get creative. And if that means going outside of traditional group health plans, what can we look at? And so that's where ICHRA came into the conversation, and Take Command in particular, since we have worked with them and had great experiences. And so we started, educating them on not only what ICHRA was, from an employer perspective, what it meant for their employees and the change that would be there, but also financially what it could do for them. And so then when the analysis was run, not only could they avoid that $3 million, but they could save an additional $3 million. So they ended up with cost avoidance plus cost savings at $6 million below. So for them, it was kind of a no-brainer, just where they were as an organization and some things that they needed to achieve from a financial perspective. And so that's why they implemented ICHRA recently for their population. Obviously, a lot of education that goes into that. This was a short runway that they kind of made that decision, and Take Command did a great job kind of expediting the implementation and that process. And I think, with any change, there's going to be, disruption and things that happen, but it's really about communication. And so that's where it's helpful with the Take Command team being able to work through employee-specific experiences and issues. And so kind of ongoing cadences and calls with them to work through those has been helpful in kind of mitigating some of that noise.